This set of slides discusses infections of the lower respiratory system, specifically influenza. I put this in here to underscore just how contagious influenza is and to underscore the need for prevention. People will often talk about getting the flu as having a GI virus, and that is not influenza. Influenza is a viral infection of the respiratory tract. There are between 25 and 50 million cases, resulting in more than 200,000 hospitalizations and 30 to 40,000 deaths every year. That is a lot of people who get sick with the flu and who have complications from influenza. It is highly infectious, as I mentioned before, and is actually a disease of the upper and the lower respiratory tracts. There are three major types of virus that cause this: influenza A, influenza B, and influenza C. Numerous subtypes. A subtype will have a letter H and a letter N, and then there will be a number following it. So if you recall, the swine flu is H1N1, and that happens to be an influenza B. You don't need to know that, but it just the notion that there are so many different viruses out there, and these viruses mutate as the season goes on. Influenza is spread by direct and indirect contact. It's spread by droplets from coughs and sneezes, and you can get it from contact with the person who has it or on an object that harbors the virus. Remember, those objects are called fomites, things that viruses and bacteria stick onto and live on. And so somebody coughs, sneezes, the droplet falls on something, they wipe their nose, they touch something, and then that object, doorknob, faucet handle, kitchen counter, computer keyboard also has flu virus on it, and you can pick it up from there. Incubation time from time of exposure to time of symptoms This slide illustrates the signs and symptoms of influenza. And if you look, they affect a lot of different areas of the body. The problem with why influenza is so contagious is that people shed virus before they have symptoms. So you can shed virus for 1 to 2 days before you even have a runny nose. And so you've exposed all kinds of people unknowingly. Symptoms, as I mentioned earlier, usually appear from 1 to 3 days after exposure. Your acute symptoms last about 2 to 5 days, and it's malaise and cough, and that cough can last for up to several weeks. You can really have a long-lasting cough after this virus. The acute symptoms usually have a very abrupt onset. Headache, fever, chills, really achy muscles, and a horrific sore throat sometimes. hacking cough, runny nose, nasal congestion. As you can see, this can be confused with the common cold very easily. So if you want to know if it is influenza, you could take viral cultures of the throat or a nasal swab, but cultures take 3 to 10 days. So they've developed these rapid influenza screens that take about 15 minutes to show if they're positive. They're much less reliable than cultures, but it's a quick and easy screen, and you can start on antivirals more rapidly. If you waited for a culture, it would be too late to start on antivirals. A culture is good because it rules out a bacterial cause. So for instance, if you had sinusitis or pneumonia or something like that. Treatment of influenza can be antiviral medications. Remember, this is a virus, not a bacteria, so antibiotics don't do any good. Antiviral drugs must be started within 48 hours of the onset of symptoms, or they don't really work. And honestly, they don't cure it. What they do is they make the course of the influenza a little bit shorter and the symptoms less severe. The hope is that they would prevent complications, but I'm not sure that that's a guarantee either. The only time you would ever use antibiotics would be if you have a secondary bacterial infection like a pneumonia or a sinusitis, and then you would use an antibiotic and that would be used much later. Most uncomplicated influenza is managed more effectively by nursing interventions than by any drugs or other forms of medical treatment. It's primarily symptomatic treatment, analgesics, uh, Tylenol, acetaminophen, nonsteroidal anti-inflammatories, lots of rest, lots of fluids. Um, the most common complication from pneumonia is the most common complication of influenza is pneumonia. And that pneumonia can either be from the influenza virus itself or from a secondary bacterial infection. The big takeaway for influenza is health promotion, and that health promotion is influenza vaccine. Everyone aged greater than 6 months without contraindications should receive the flu vaccine. The flu season in the Northern Hemisphere begins as early as October and ends as late as May. I've seen it go into June at times. And so if it takes 2 weeks to get full immunity, the earlier you get the vaccine, the better. Vaccine is usually available right around mid to end of August. People who live with or care for persons at high risk for influenza or at high risk for complications, including household contacts who have frequent contact with people at high risk and who can transmit influenza to those individuals, really should get the vaccine, and healthcare workers really should get the vaccine. I've got a vaccine lecture and PowerPoint on the influenza vaccine itself, and so that's something that goes along with this. Just a little bit, kids, because I said, greater than or equal to 6 months. Little kids who are on their first dose actually get a divided dose. They get 2 doses. So they'll get the first dose as early as possible, and then the second dose is usually about 4 weeks later. And the sooner you start this right when the vaccine becomes available, because then you can't have your second shot until a month later. So it's really important to start the little guys who need 2 doses early. There are lots of different kinds of vaccine products, and again, I discussed that in the vaccine PowerPoint. This is from an advertisement by GlaxoSmithKline, and they are a manufacturer of the flu vaccine. There are several different drug companies who make flu vaccines, and it's just sort of a myths versus facts. And these are things that you really ought to know because people believe this stuff. The flu shot can give me the flu. No, it can't. Vaccines are not proven to prevent the flu. They absolutely are proven to prevent the flu. The problem is when you make the vaccine, you have to guess at the flu strains, and then once you've started to make the vaccine, those flu strains mutate. So even if they don't completely prevent it, they can attenuate it. And so there is no reason not to get a flu shot. And then I should wait to get vaccinated so that I'm covered through the end of the season. You are covered through the end of the season. The immunity lasts through the whole season. That is not a problem. It's better to get the flu than the flu vaccine. No, absolutely not. You don't get complications from the vaccine, but you do get complications from the flu. So vaccines are just really, really important. And I can't stress that enough. So please make sure you watch that vaccine PowerPoint. When I mentioned people at risk for complications from the flu, I was talking about kids younger than 2 years and adults greater than 65 years. Individuals with chronic medical conditions, pulmonary conditions like COPD or asthma, cardiovascular conditions like congestive heart failure. Hypertension isn't really a risk factor for complications. Um, Renal disease, hepatic disease, any kind of hematologic issue, metabolic issue like diabetes, neurologic disorders, and any kind of hemoglobinopathy. So anybody with chronic illness really is at greater risk for complications from the flu. Obviously, immunosuppressed individuals, it's very important. Pregnant women and women up to 2 weeks postpartum, and this is another thing, pregnant women should get the flu vaccine. It protects them and it protects their unborn child. For whatever reason, genetically, American Indians and Alaska natives are a little bit more at risk for complications. Morbidly obese individuals. Residents of long-term care facilities are more at risk for complications for a number of reasons, partially because they're older usually, partially because they tend to have more chronic medical conditions, and then also because they are just all cooped up together. They're more likely to get the flu, and they're less likely to have been exposed to a lot of other viral things, so they may not be able to get as much of an immune response as people who are out normally socially active in the world. As we discussed previously, pulmonary complications such as bronchitis and pneumonia are the most common. Again, these can be from the flu virus itself, or it can be a secondary bacterial infection. You can also get exacerbations of chronic cardiac and respiratory conditions. You can get neuromuscular and cardiac complications. It's rare, but it can happen. And then other minor complications include sinusitis and acute otitis media or an ear infection. Let's talk about a case that you may be likely to see if you work in long-term care. A 97-year-old resident of a long-term care facility has a history of COPD and diabetes. She develops atypical flu symptoms. She's lethargic, confused, and feverish, and no other residents have the flu. Now remember, older adults quite often do have atypical symptoms when they have dehydration, when they have uh, pneumonia, when they have other infections. So you're just not always certain what's going on when somebody is lethargic, confused, and feverish. During a chart review, the nurse discovers that the resident has not had influenza vaccine. Her son refused for her to get it as he thought it would give her the flu. Because of the mental status changes, the nurse wants to send her out of the hospital, but the family, or excuse me, out to the hospital, but the family requests that they not do so. Question number one, how could she have contracted influenza since nobody else in the other residents of the facility have it? Well, she may have contracted the virus from a visitor or a staff member. There's people coming in and out of facilities all the time. And as I mentioned before, it's really easy to infect other people because you shed virus before you know you have symptoms. Also, people who begin to have symptoms of influenza often just think they have the common cold. This lady is at increased risk to contract influenza because of her age and because she has chronic illness. She has COPD and diabetes. How could this have been prevented? Well, this could have been prevented with a flu vaccination. The family needs education regarding this. Also could have been prevented by good hand hygiene, by staff and visitors, and by encouraging sick people not to visit or not to come to work. That would also help. What can be done to prevent her from developing complications that could lead to pneumonia or really even death in someone this old? If it is in with if it is within 48 hours of symptom onset, she could get an antiviral agent, and that would reduce the symptoms and shorten the course of the virus. Again, good nursing care is really important here. Providing rest, fluids, acetaminophen, comfort measures, aspiration precautions are really important, especially for someone this age. Also, monitoring for signs and symptoms of secondary infections like pneumonia. What can be done to protect other residents and staff at the facility? Well, other residents and staff should be vaccinated, but the vaccine takes 2 weeks to provide immunity. So the horse has already left the barn, and she needs to be in isolation with droplet precautions. What other concerns should the nurse have, and what other healthcare team members should be involved in her care? A decision has to be made whether or not to send her out. Look at advanced directives, talk to family about the goals of care, but anybody who has mental status changes really deserves to be evaluated. She may have influenza, she may be dehydrated, she may have a urinary tract infection. You don't know, and if you don't know what to treat, it's hard to treat it. She also has COPD, so she may be hypoxemic, come to think of it. So you got to decide whether to send her out. And this is a family conference with the nurse, the infection control nurse there at the facility, and also with the provider.